In Illinois' response to COVID-19, I have said since the beginning that we are operating with a specific focus on our residents who are most vulnerable to the effects of this virus. Our seniors, our immunocompromised individuals, and people who have pre-existing conditions. And because of decades of disparities in healthcare access and delivery, we've seen the worst effects of this pandemic fall disproportionately upon the backs of the communities of color in our state. That's especially true in our Black communities, our Native American communities, and our Latinx communities. Jaime DiPaolo and Dr. Del Rios have joined our daily public update because I want to bring more attention to the work all of us are doing to support our more vulnerable populations, especially the Latinx community, which is now testing positive for COVID-19 at the highest rate of any demographic group in Illinois. Although nearly half of those who have been tested did not fill out their demographic information, of those who did, 7.6% self-identified as Hispanic. Of these more than 26,000 individuals, nearly 16,000 of them have tested positive for COVID-19. That's a positivity rate of 60%. That's nearly 3 times our state average. As a point of comparison, for the half of people who left their race blank on their forms, about 18,000 tested positive for the virus. That's 10%. We don't know what portion of those unknowns might also qualify as Hispanic or Latinx, but what we do know is that our data from the start until today shines a concerning spotlight on which of our residents are most likely to get sick from COVID-19. Decades of institutional inequities and obstacles for members of our Latinx communities are now amplified in this pandemic. And while we can't fix generations of history in the span of a few months, we must advance equity in our public health response today, everywhere and anywhere we can. My administration has made it a priority to enter into testing partnerships in as many areas around the state as possible, with a focus on communities home to significant populations who are more vulnerable to this virus. We now have over 200 public testing sites in Illinois, a third of which are located in communities with a significant Latinx population, measured here as greater than or equal to 17%, which is the Latino population number statewide. The reason many of our partners in Latinx communities have been chosen is not just for their locations, but also their accessibility to other services, particularly language services. Under the 1964 Civil Rights Act, all U.S. hospitals receiving federal funds are required to provide language services to patients with limited English proficiency. But in practice, some are better equipped than others. Another bullet point on the long list of features about our national medical system that deserves extra attention in the post-crisis management world. So in bringing in our public partners in the Latino communities, we are proactively focused on community health centers that prioritize accessible services and are often home to bilingual staff, such as Alivio Health Center, Erie Family Health Center, VNA Healthcare, Esperanza Health, Howard Brown, and Greater Elgin Family Care Center. Additionally, of the 7 drive-through sites that the state does formally run, each offers bilingual support for Spanish speakers. And as we build on our existing contact tracing abilities at local health departments, we will continue to make a push for robust relationships with trusted partners in Latino communities and ensure our tracking capabilities reflect Illinois' multilingual diversity. On another note, I want to reiterate that we are providing housing for those who need assistance with self-isolation if they've been exposed to or diagnosed with COVID-19. Across the state, there are multi-generational families of all backgrounds living under one roof. And especially in our cities, we have families and roommates living in smaller apartment units that make self-isolating much more difficult. To support our residents who need help to quarantine in a safe space, the state has made available thousands of free hotel rooms for residents who may need to move out of their home as a precautionary measure to make sure they keep their families or their roommates safe. These hotel rooms offer full wraparound services, including meals and medical assistance. And again, they are entirely free for anyone. They can access this housing support by contacting their county or city public health departments. The Illinois Department of Human Services has also utilized our Illinois Welcoming Centers as a hub for free resources for our immigrant communities, some of whom are also members of the Latino community. That's everything from emergency funds to provide food and necessities, to enrollment in SNAP and WIC benefits, to testing location information. Additionally, the Illinois Coalition for Immigrant and Refugee Rights has worked with welcoming centers to distribute information about these services to a wider audience. For more information on our welcoming centers, I hope you'll go visit dhs.illinois.gov/help-ishere. That's help is here. I want to say that again, dhs.illinois.gov/help is here, and then click Help at Home. In today's conversation, I also want to address workers' rights in the midst of this crisis. This pandemic has exacerbated existing socioeconomic inequalities, and that affects many communities, including the Latinx community. I want to ensure that everyone listening knows where to go if you believe an employer in your area is not following CDC guidelines regarding safe and sanitary practices in the workplace. The Illinois Attorney General's Workplace Rights Bureau, the Illinois Department of Labor, and the U.S. Department of Labor are investigating and enforcing CDC guidelines in non-compliant facilities. It is in everybody's best interest for these essential workplaces to take every precaution necessary to protect their workers. Employers who are bad actors need to be held to account. For public employers such as the state or local governments, public works departments, police and fire departments, complaints should be submitted to the Illinois OSHA through the Illinois Department of Labor. For private sector employees like gas stations, restaurants, and manufacturers, direct complaints to federal OSHA. Both of those reporting mechanisms can be found on the Illinois Department of Labor website at illinois.gov/IDOL. Employees from both the private and public sectors can submit a complaint with the Illinois Attorney General's Workplace Rights Bureau also. I want to also address the mask or face covering requirement that took effect on May 1st. At this time, face coverings are required in public situations where social distance cannot be maintained, and that applies only to those who are medically able to wear a mask. I recognize that this is a new practice for many in Illinois and the entire United States, but it's on us to change how we think about face coverings. Protecting your fellow Americans by wearing a face covering in public is a collective act of patriotism. And doctors will tell you it's one of the best things that we can do for public health right now. There have been reports of misplaced assumptions about masks, leading to incidents of racial profiling against Latinx and Black Americans, especially men, as well as xenophobic attacks against Asian Americans. And I want to call on the public to help us stop these hateful incidents by speaking out and standing up for others in your community. If you witness or experience mask-related discrimination or any form of discrimination, please report the incident to the Illinois Department of Human Rights at idhr.webmail@illinois.gov. Let me say that again. You can send an email to idhr.webmail@illinois.gov. Finally, while there are so many individuals and organizations that are doing critical work at this moment, I want to recognize some of the folks who have played a particularly important role in shaping the state's response in this pandemic, especially to the challenges facing communities of color, ensuring that the Latino community is well represented in our decisions as well as our solutions. First, the IDPH COVID-19 Equity Task Force, which works to develop plans and communication strategies to reach communities of color and other vulnerable populations, including regarding the long-term mental and physical consequences of the pandemic. And of course, I want to recognize the contributions of the entire Legislative Latino Caucus. Co-chairs Representative Lisa Hernandez and Senator Omar Aquino, as well as a few individuals who have been incredible voices for justice and in helping with outreach in their districts. Representative Corina Villa on manufacturing issues, Representative Fred Crespo on education, Representative Selena Villanueva on public health, and Representative Delia Ramirez on housing. My team and I are working with communities across the state to address ongoing challenges, as well as to strengthen the efforts of trusted leaders already advancing COVID-19 awareness and prevention. Yesterday would have been the annual Latino Unity Day in Springfield, my second as governor. Last year, I was so proud to join the Legislative Latino Caucus, my deputy governors, Sol Flores and Jesse Ruiz, members of my cabinet who are teachers and nurses, our union workers and labor leaders, our police officers, our firefighters, state legislators and mayors, the people who help make Illinois the greatest state in the nation. This year, we can't gather like once we did. But I'll say again, what I said then. The Latino community is the Illinois community. We are in these fights, and all these fights we are in together.